It also grows from being exposed to situations that are difficult to forget. S was one of those situations for me. She had bone cancer and was my first patient. Her pain management became my first real battle as a nurse. It was not easily won, and it never seemed to end. One day during that first week, her doctor came out of her room while she lay inside moaning in pain. At the nurse's station, he made a low, guttural sound that was barely audible. Buzz. Then he said, almost casually, "Someone must have left the radiation on too long." Something in me changed at that moment. I saw a woman suffering terribly, and I saw a physician treating that suffering as though it were material for a joke. Her family had placed their trust in him. She had placed her body and her pain in his hands. His attitude felt careless and deeply disrespectful. I was furious, and I did not hide it very well. Eventually, the charge nurse spoke to me about my attitude toward him. She explained that the physicians were independent of the hospital and that they brought in business. In practical terms, she was telling me that doctors like him helped keep the hospital full and helped keep people like me employed. That explanation sickened me almost as much as his comment had. I was young, inexperienced, and still learning that healthcare was not driven by compassion alone. There were hierarchies, financial realities, politics, personalities, and unwritten rules. I had entered nursing believing that suffering would always be the most important thing in the room. It was painful to discover that sometimes it was not. I went home emotionally drained. At the time we had a new baby, I would call my husband before I arrived so he could take our son into the backyard while I came in through the garage. I removed my scrubs there, dropped them directly into the washing machine, walked through the house, and went straight to the shower. We took every precaution we could think of to protect him. Some nights, still in my robe with my hair wet, I would collapse into the recliner. My son would lie on my chest, and I would fall asleep with him there. Sometimes that was the only time we had together. I had wanted children for so long, yet nursing seemed to take the best hours of my day and leave my family whatever remained. That first job taught me far more than how to care for patients. It taught me that advocacy can be exhausting. It taught me that doing the right thing does not always make you popular. It taught me that institutions have priorities that may not always match your own. Most importantly, it taught me that anger can come from a good place, but anger alone is not enough. A nurse has to learn how to turn outrage into action. That is part of finding your voice. The younger version of me saw only two choices: respect the doctor or refuse to respect him. Experience eventually taught me that there was another path. I could challenge poor care without surrendering my professionalism. I could advocate for pain control, document what I observed, escalate concerns, involve the chain of command, and keep the patient at the center of the conflict. Professionalism does not mean pretending something is acceptable when it is not. It means learning how to confront what is wrong in a way that gives the patient the best chance of being heard. That experience contributed to my eventual decision to leave my first hospital job. There were other reasons, including changes in the workplace and unionization, that I was only beginning to understand. But beneath all of it was a growing realization that I could not continue indefinitely at that pace. When I learned I was pregnant again, I was elated. Then I cried. I could not imagine fitting one more thing into a day, a week, or a year that already felt completely full. The children I had wished for so long were being held by my husband and my mother while I drove away to care for other people. That realization became another kind of nursing lesson. Finding your voice is not only about speaking for your patients. Eventually, you must learn to speak for yourself. You have to recognize when something is wrong, when something is costing too much, when a boundary has been crossed, and when the life you are living no longer matches the life you want. Some lessons make us better nurses. Others teach us how to remain whole enough to keep being one. Building the nurse brain. What is a nurse brain? Nurse brain is the practical wisdom a seasoned nurse develops through knowledge, experience, observation, pattern recognition, clinical judgment, anticipation, communication, and reflection. It is the ability to recognize what matters in a situation, understand how pieces of information connect, anticipate what may happen next, and respond appropriately. It is not a separate kind of intelligence, and it is not a substitute for education or evidence-based practice. It is the way nursing knowledge becomes more useful, more connected, and more intuitive through experience. Every nurse begins somewhere. Nursing school provides the foundation. Anatomy and physiology, pharmacology, assessment, pathophysiology, communication, safety, ethics, procedures, and the principles that guide patient care. Students learn what is considered normal, what can indicate a problem, what interventions are appropriate, and when a situation requires immediate attention. This knowledge is essential because a nurse cannot recognize what is significant without first understanding what should be expected. Yet knowing the information is different from knowing what to do with it.